Savannah. I'm presenting today with Zachary, Jasper, and Marinna Smith. We're third-year medical students at the University of South Carolina School of Medicine, Greenville. The project we are presenting on today, it was an effort to integrate harm reduction curricula into medical school education. We all took an interest in substance use disorder, really understanding its treatment as well as different options we can offer patients who are struggling with substance use disorder. It's a prevalent healthcare concern across all healthcare specialties, so medical students are going to encounter it no matter what they're going into. It also increases the risk of several health conditions, so we believe it's an important thing for people to understand. In particular, we've noticed there was a decrease in understanding on medical students of harm reduction techniques as well as possible stigma surrounding these things. They focus on reducing the negative impacts of substance use, and they can include methods such as syringe exchange services as well as Narcan and naloxone distribution. So we've been working with the faculty at our school to really help create an education for medical students to focus on both harm reduction techniques and substance use prevention and treatment starting early in the first year of medical school. And we're hoping that this can expand the knowledge on substance use disorder as well as decrease some existing stigmas that surround it.
Yeah, like she said, we kind of identified that this was an issue that we wanted to work with. So kind of going forward with that, we had to decide like, how are we going to bring this to the administration of the school? So what we went with is we did a curriculum proposal, creating that for the school and presented that to like our IPM small group leadership. So what we really wanted to do was focus on in that curriculum was focused on the integration of harm reduction, specifically about like substance use related harm reduction activities, as well as like disease prevention within like substance use. So like your clean needle exchanges, syringe exchange programs, etc. So we kind of set this lecture day, etc. up by like we wanted to kind of including like a discussion like about motivational interviewing, how do we work with patients that have substance use, as well as providing them with some just informative general topics kind of going forward. So we were able to provide them also with 2 standardized patient encounters that we created that would allow the students to practice what they've learned and to interview patients that have substance use disorders. That way, hopefully they feel better prepared going forward in their M3, M4 clinical years to interact with patients that have substance use. So we decided to collect pre and post data using the acceptability of harm reduction data collection instrument, just kind of looking at their attitudes, knowledge bases, etc., around harm reduction principles and like how do they feel? Like, is it still stigmatized? Were we effective in changing their minds and increasing their willingness to use those things in our lecture? And then so we worked with that. That got accepted by our faculty, and we were able to kind of create that and distribute our surveys anonymously over Canvas, which is our kind of school online homework type website. So we were able to use the RedCap data collection software to do that. So it stayed anonymous and we were able to collect that through. So we did this in kind of mid-January and our data was collected and the school was very happy with that. And they're hoping to continue that on throughout the next few years. And then I'll let Zach kind of talk about what we're doing with that data right now.
So we're taking that data right now and kind of waiting for it to all come through. I think there's a few stragglers, as there always are on RedCap, to finish the pre and post surveys. So we're waiting for those to get collected. And then we're going to go over with Dr. Stevens, who's one of the faculty that we worked with closely, and go over that data and start to kind of derive information from it and see kind of what we can do with that information. Our hope is to eventually go back and hold a focus group with this M1 students that were a part of this inaugural curriculum refresh and kind of understand what else we can do for this program to better enhance the students' experience, because it's a challenging topic to talk about. And our hope is that ultimately we'll provide the best, easiest, welcoming environment for these students to be able to discuss harm reduction techniques, because it's something we'll all see in our career. So now that we've kind of integrated this into the M1 curriculum, our hope is to start to think about how we can integrate this M2, M3, and M4 to continue to reinforce these principles so that when we eventually are out of medical school and into residency, we're more equipped to practice these techniques to refer people to whether that be, because we want to meet people where they are as opposed to just trying to implement, say, stop. I think we've seen time and time again, that's not as beneficial as meeting them where they are and providing them with ways to have safe substance use practice.
So to kind of touch and kind of end things up, like those pictures in the middle are some of the things we kind of talked about a little bit. So we kind of things that in our community are available. So we work pretty closely with a group called Challenges Inc. And they have like a harm reduction bus that goes out to like some of our school, like there are like kind of free community health clinic days and things like that. And they also are all throughout the community. And they're able to provide like naloxone, Narcan, syringe exchange services, as well as like a supportive environment for folks who are using substances, et cetera, to kind of come and get support. And we found that that is really honestly a great way into getting them as like a gateway into addiction treatment. But yeah, so we're excited about the possibilities of where this will go forward, and we're happy to take any questions that you have. Thank you.
Thank you. I had a quick question. Can you talk a little bit more about the specific questions in your surveys, like what those questions are and what are they trying to target?
Yeah, for sure. So we are specifically using like the harm reduction data collection instrument. So like what we're really interested in and collecting is information specifically about their attitudes and things towards harm reduction. Like what are their knowledges about harm reduction? So like with that, what are their attitudes regarding like, is it something that they look favorably towards? Is it something that they dislike, etc.? Like, because what we've realized, especially kind of being in like a Southern aspect environment ourselves, it's like talking to a lot of people and even our peers, it's just, and honestly, unfortunately, the faculty and doctors that we work with, we've seen a lot of attitudes and negativity towards people who've used substances and just, they're never going to change. Like, why am I going to give them these things, et cetera, et cetera. So like what we were really doing is like with this tool that we chose to use was kind of looking at specifically their attitudes kind of towards that. Like, were we able to provide them like knowledge and acceptance towards these types of things? Like the idea of like, for me, even just like the idea of giving someone a clean syringe, like, is that enabling someone to use drugs? Or is that something that I'm helping to reduce the administration of hepatitis C? Am I able to keep, and that's something we've seen in areas that have syringe services available, like we have decreased rates of hepatitis C. So it's like, is this a function of enabling someone to go and use drugs, or is it a way to decrease risk? Is it a way to bring people into our hospital system, bring them into an addiction clinic, and make them more comfortable with us as providers as well? So that's really what we were trying to target with that, with this survey, is just to try to see like, we're really interested in the attitudes towards substance use specifically right now, as well as like kind of the stigma around that, because that is really what our goal, especially in this first year, is to try to change. Like less so about their knowledge of like, how do I do this? How do I implement this? And more so, would they even be open to implementing that?
Wonderful. Thank you so much.
Uh-huh.